See, I'll tell about fever. This is the very simplest topic according to many doctors, but it is the most difficult topic because it is very common and it is very difficult to cure. It has various presentation, it has lots of causes. So we will set aside everything. I want it to be so simplified so that even a 6-year-old small kid will understand. I want to make it so simple. So I will tell you a story. Suppose a small terrorist enter into India and there will be spies in and around everywhere in India. These spies will immediately send an alarm to the army and intelligence agencies that some terrorist has entered India. At that time, the situation is called an alarm. There will be an activation of intelligence agencies and the nearest army center. So that is the reaction of the body. Fever is that spy which tells that some terrorist has entered. Now, question number 1. How much is the level of fever that required to tell it is fever? Let me tell you, about 100 degree Fahrenheit we can call it fever. Now, what should I do when fever occurs? Fever is a spy. It is telling the body to produce immunity. So one thing you have to do is make the temperature comfortable and keep the temperature in a comfortable level, and that too using maximum natural methods. When should I use crocin or baby Josic or Dolo or whatever company name, paracetamol, calpol and other things? I will tell you. See, some spy is telling that there is something going around wrong in the country. Will you catch hold of the spy and put the spy in the jail? No, that is stupidity. That may be harmful. But suppose the spy is telling, oh there is terrorist, oh there is terrorist, there is a lot of terrorist. If the spy is becoming too much hyperactive, you will calm the spy down. Koi baat nahi. No problem, no problem. We will adjust. Natural methods are preferred. What are the natural methods? I will tell 4 or 5 things. Decrease the clothes. In adults, if they can tolerate, they can put more clothes and create more hot environment so that their body becomes more immune. But maintain the temperature in children around 100. For that, decrease the clothes, decrease the room temperature to a comfortable level 26 or something. Whole body sponging using lukewarm or tap water, depending about level of fever. High level fever, you will have to use tap water. Normal fever, small fever, use lukewarm water. And extra liquids, extra vitamins and herbs. What is vitamin and herbs? You can give any multivitamin 3 times so that the WBC will get energy. Herbs, you can give turmeric, black pepper mixed with desi ghee, clarified butter. Mix it, create a small paste and keep it under the tongue or into the gums. Just like people take tobacco. You can take it 10 to 15 times a day or even 8 to 6 times a day, depending about how much baby cooperates. Even if the baby is sleeping, you can keep it inside. That will give WBC enough power to immediately boost up the energy. What about high fever? Even in high fever, first of all, you try to do it naturally. Even after 45 minutes, if you feel baby is too much uncomfortable with fever, then you can give crocin. Crocin, the bottle has, according to the weight, the dosage required, but keep it minimum. Should I give regular dose of crocin? Why are you troubling the immunity? Let the immunity improve. Why are you simply suppressing the immunity by giving a lot of crocin? Only in case of too much of fever, uncomfortability, you should prefer crocin. Otherwise, you are just torturing the liver, no? Don't torture the liver. What about vaccination? During vaccination, it is a false alarm. You are not giving live injection in which there is a bacteria which is live. Usually it is a killed bacteria and it may not be an extremely emergency situation. These are all attenuated bacteria. So the fever, you can give regular doses also, that is not a big deal. But for immunity during infection, no regular doses. What about ibugesic? In addition to liver, ibugesic will damage your kidney also. So liver and kidney. Especially during dehydration, especially during diarrheal disease, and then in addition to that there is high fever and you are giving ibugesic. This is a dangerous situation. You can cause kidney damage. It is preferred for pain and during vaccination when the baby is not having much problem. And but certain babies who are having lung which is sensitive and causes nebulization requirement, asthma and all, those babies ibugesic can precipitate also or worsen asthma. So during these children you will have to definitely avoid it. For sure you will have to avoid it. Now what will happen if the fever is too high? Won't it affect the brain? Yes. Certain babies who are having a lot of chemicals in their brain, especially babies who are not cared for, not loved much, who are sensitive in behavior, emotionally unstable, who has history of head injury or not without head injury, who are sleep disturbed babies, who are having lot of toxins in the body, chemicals and high infection and low immunity. In a combination of these, which less of omega-3 in the brain, DHA deficient baby, multimineral deficiency, iron deficiency, these deficient baby and small babies, definitely certain fever can go and cause seizures in the brain. Then they'll put the eyes like this upper and they'll go like this, and then that is a rare condition. Not that rare nowadays. In my clinic it is rare because I emphasis on breastfeeding, every mother breastfeed and other immunity tips. But if you have a confidence in the baby's immunity, you don't have to give for regular crocin. Even regular crocin, according to scientists, it doesn't prevent the fever getting into the brain. So strengthening the brain is another video which we will do later on. Now what if the fever is 102 or 103? It may not, the level of fever may not indicate high infection. It can also be a very low immunity. So you don't need to be alarmed about the level of fever. Definitely if it is persisting for a day or two, about 4 records of 102 then or more, then I am a bit worried. And in that babies I will search, I would really like to see them and search for focus of serious infection, especially urinary tract infection or throat infection or lung infection. This is the thing I do. And does fever indicate strong infection? No. It could be two things: strong infection or low immunity. That may not be, the level of fever may not indicate that. What will happen if there is strong infection? Your immune system is occupied with enough and more power to even destroy any amount of infection and bacteria. But you need to support it with turmeric, pepper, ghee and proper multivitamins. And in addition to that, focus of infection will be found out by the doctor. We will start definitely the antibiotic if required. We will definitely help you. You are not alone like Arjun without Shigandi. We will act like Shigandi, stand in front of you and help you to fight any dangerous people like Bhishma. Even if it is a severe infection, there is nothing to worry. We have enough and more antibiotic. Why don't you give it on the first day? No, first day antibiotic may not be a logical option, because we want the immunity to be increasing and we want to be really sure it is a bacterial infection. We want to really find out the focus of infection and then to opt for a specific antibiotic which will cause the minimal amount of body injury and maximum amount of damage to the specific kidanu, specific bacteria. That is our motive. So delaying an antibiotic is just 50 rupees. Who cares about 50 rupees these days? That is in India, if you consider in terms of dollar, it is hardly 70 cents an antibiotic. That is nothing. This pennies. But the damage the antibiotic causes will last for 3 to 4 months or even 6 months. So the frequent antibiotic required in babies eventually will have an increased higher chance of tonsils, recurrent infection, resistant bacteria. And also they can go in for later stages of later in life they can become obesity, diabetes and all. So this is not correct. For every fever you will have to give antibiotic. What if it is persisting for a week? No, it is very rare these days, unless there is low immunity, that fever is going to persist for a long time. Mostly we have seen that lot of paracetamol is given to prolong the disease a longer time. Lot of antibiotic is being given in viral infection, so that there can be something called as a drug fever also. So it may not be a prolonged disease, doesn't mean, it just may be a low immunity. What should I do about immunity? That is another video, I will tell you. Now what you need to do, you have a short revision about fever. Fever is a spy which tells you there is a terrorist. Nothing to be worried about. You just have to control the spy from going over emotional. Okay, by using natural methods, rooms it need to be cooler, and luke water or tap water sponging all over the body, and reduce the clothes, and extra liquids, extra vitamin, extra turmeric, and even in vaccination you can safely give crocin a bit more time, or even ibugesic a bit more time. But during dehydration, diarrhea, absolutely no ibugesic. Even if it is high fever, I would recommend only crocin or other paracetamol combinations, that too after 45 minutes of doing natural remedies, not instantly. Level of fever may not indicate anything, it will be just small viral with a low immunity. Immunity boosting, you will put up another videos. I have already put up 4 or 5 videos that you can see, but definitely I would want everybody to share this, because parents need not visit the doctor for every small things, especially during corona. But definitely even in the night and for emergency, these may not be safe. So you can do these natural remedies, and next day if you feel like there is something is there, especially small babies, we would like to see 6 months, 4 months, 3 months, 2 year and all. About 2 year you can give turmeric and try for a day or two, so most often it will recover. Take care, have a good day. You share my videos, otherwise I will feel sad. Okay, take care. Okay, bye.